Natural healing. So we're going to just wait a minute. If anybody is here or joining us live, that would be great. Please let us know where you're at. Would love to hear from you guys. And just give a shout out so that way I know that you guys can hear me okay and that you guys are able to see this okay. So we'll just wait a few minutes. All right. So if you're out there and you're watching, we'd love to see you and hear from you. Okay. So we're going to begin and we're going to be talking about headaches, we're going to be talking about seizures, and we're going to be talking about personality changes. So headaches, right? Headaches are some people can kind of deal with headaches. It's when they turn into migraines that it can be actually very unbearable. So a lot of people, with migraines, they are down and out for the count, especially if they don't catch it fast enough. So they're in bed, lights have to be turned off, sound has to be down, they get nauseous, they can see like flashes of color, which is called an aura. A lot of them are noise sensitive, sound sensitive, and it can wipe you out for a couple hours to a couple days. Most people, it's a couple hours to a full day. And what does that do for a person? Well, people wind up missing functions, family functions, kids' recitals, doing things with the kids or family, even missing work. So that costs time and money, right? Headaches are a little bit not quite as severe in the fact that most people don't get nauseous when they get a headache. They don't have necessarily and of course each person is different. So if you're experiencing that, and it's just a headache, it's not a full-blown migraine, it can happen. It's just usually like light sensitive nausea, vomiting, sound and smell that's usually more associated with migraines than it is with headaches. But headaches can be pretty darn severe too. And a lot of times people can take over the counter for headaches, Advil, Excedrin, the headache medicine, Tylenol, things like that, ibuprofen. And a lot of times it'll handle the headache or at least get them functioning well enough so that way they can handle their day-to-day activities until the next one. So, how many times a day or a week do you suffer from headaches? Some people get them daily. Some people have daily headaches. Some people have it a couple times a week or a couple times a month, or they'll get daily headaches and then the migraines they get a couple times a month. How fun is that? Not. And so, what do you do about it? Okay. Most people are on, some of the medications, like, this one blood pressure medication called propanolol. It's a beta blocker. That medication can actually be used to prevent, you know, um, headaches or migraines. But what are the side effects? Because you're chemically treating it. And if you take yourself off of the medication, then the headaches come back. So is it really addressing the root cause of why you have your headaches? Or just like taking that ibuprofen? Yeah, it temporarily fixes it until the next one. So, and then personality changes. Let's talk about that real quick. So, personality changes, things like schizophrenia. It's a change in somebody's behavior or multi-personality disorder. Okay. Um, Somebody who for no reason is always angry. Have you ever known somebody who's always angry, or even kids who are just angry, or most kids are nice, but some kids are not nice and they're just difficult. They either have temper tantrums all the time or they're just like not nice kids. Or maybe they're irritable all the time. So that can be personality changes. And then seizures. Seizures are not fun, guys. I don't know if you know anybody who has had seizures or if you yourself is suffering from seizures. And there's different forms of seizures. There's the grand mal, where you see them, they're down on the ground, they're convulsing a lot and things like that. You can have, smaller ones where they just get a blank stare in their eyes, and where it looks like they're zoning out. So there's all forms of different types of seizures. And that can be pretty scary, especially if you have the bigger type of seizures, because you can get hurt. You can physically get hurt because the way you fall. Sometimes you can't drive. You have to be like seizure free for quite some time. Usually it's about 3 months and of seizure free activity. And they put like these electrodes all over your head to find out whether you're having seizure activity. And then they give you medication. These medications can make you feel dopey and groggy and tired and lethargic. They can cause a lot of liver problems. So you need like frequent blood work to make sure that your organs are functioning properly. You need to take blood work to make sure that the medications are at a therapeutic level, meaning that if you don't have enough of a drug in your system, then you can have breakthrough seizures, which means that even though you're on the medication, you still wind up with a seizure if the levels are not proper. Okay, doesn't sound like a lot of fun to me. And some people can't work because of their seizures. If you have kids who have seizures, then they're missing out on school time and some other things. So, not so fun. Well, guess what some of the symptoms, so these are diseases, but they're also symptoms. Guess what the underlying root cause is? So, believe it or not, in the Merck manual, so the Merck manual is an extensive resource. It used to be in a hardcover. You can actually find it on the internet, but it was like a huge book of information, of resources, of research articles, and practitioners like physicians and nurse practitioners and physician assistants can all look up different drugs and medications and different disease or symptoms. They can treatment options. So the Merck manuals is actually for Western medicine. And guess what the Merck manual says? So I actually looked this up, and I'm going to botch this. So if you're joining us, would love to hear from you. Say hello, let us know where you're at. Let us know that you can actually hear us. So anyway, so these can actually be from parasites, and it actually states that I'm not going to pronounce this, echinococcus. And this is a type of parasite that is a flatworm. It's part of the cestode family. So, and this is from the Merck manual. And coenurosis, so it's a flatworm. There's tapeworms. I think they're all kind of in this cestode family. Coenurosis is the larvae, and then schistomiasis is actually caused by blood flukes, and it can actually be found in fresh water, so things like lakes and rivers. And that's where this parasite comes from. But there's tons of other parasites, and they come from many different sources. So where can you get actually parasites from? You can get them from swimming in a lake or ocean. You can get them from the soil. So there's microscopic organisms in the soil. You can get it from your pets. You can get it from bug bites, so mosquito bites. You can get parasites from tick bites, spider bites. You can get it from eating sushi or undercooked meats or medium rare meats. So like, who likes a bloody steak, right? So good, yummy, bloody, red steak. And that's an undercooked piece of meat. So guess what? It's got parasites. You can also get parasites. Moms can pass it in utero to babies. Okay. Husbands can give it to their wives when they're intimate, believe it or not. So these are ways that people can get parasites. And if you've never done a parasitic cleanse, guaranteed you got parasites. And in the Merck manuals, they really state that a lot of these things happen in third world countries. That is not necessarily the case at all. Actually, a lot of Western culture and civilization has parasites. So it's not just in, places with underdeveloped water purification processes. And in fact, our tap water actually has parasites too. I posted an article last spring on a patient who used a tap water and did a neti pot nasal wash and got a brainy eating amoeba using tap water, and he died. So parasites are actually in our tap water. So it doesn't have to do with just poor filtered water. It can be from our tap water too. And what are some other symptoms? So you're just like, okay, that's great, but I don't have seizures. I don't have headaches. I don't have migraines. I don't have a personality disorder, you know, but what are some other symptoms? They can be eye floaters, nightmares, insomnia, because parasites are more active at night. Okay. Itchy skin, psoriasis. And if your skin itches more at night, chances are it's parasites because, again, they're more active at night. Any type of gut issue. So acid reflux, colitis, diverticulitis, nausea, bloating, extreme gas, abdominal pain. These are all signs of parasites. Anxiety, depression kind of goes along with, because if you want to take a look at it this way, our personalities, we're not supposed to be depressed and anxious. So if you are anxious and depressed, I guess that would be kind of considered a personality disorder or personality change, right? So things like that can actually be from parasites. Okay. Now, what can you do to get rid of parasites? Well, you can take things like garlic, clove, black walnut, oregano. These are just some of the things that are really, really good for getting rid of parasites. But we do something slightly different here at the Oasis for Natural Healing. So we use a technique called quantum nutrition testing. That allows us to see exactly what's going on with you and exactly what supplements you specifically need. And we can do this in person or virtual. And then we also don't just stop at parasites, but we check your body because you might have multiple causes of why you have your symptoms. Yes, it could be parasites, but you might have things like food intolerances. You might have things like heavy metals or heavy chemicals. So we want to address the whole reason why you have your symptoms, not just part of it, not just one thing, but we want to get to the root cause of everything. And that's why it's good to see a practitioner who knows what they're doing, because they will look at your body as a whole. Because now everybody's jumping on the parasite rave, parasite cleanse and got to do parasites, which is great. That is very good. And everybody should actually be doing, and that's what we do here. But we look at other things too on why you have your symptoms. So, and everybody should be doing a parasitic cleanse at least 1 to 2 times a year indefinitely. And you could do protocols. You can absolutely do protocols. But what quantum nutrition testing allows us to do is actually tailor make a program specifically for you. What combination of supplements, what combination of herbs? Maybe you don't need herbs. Maybe you need a homeopathic remedy. Okay. And then how much? It's not what the bottle says. We actually tailor make the dosage based what your body needs. So we figure all that out and we put together it in a program specifically designed for what your body needs. And we look at you as a whole. Do you have food intolerances and that's maybe causing inflammation? Do you have heavy metals? Do you have heavy chemicals? Things like that. What is the underlying cause? And like I said, it could be one or more multiple things. So if this is something that you're interested in and would like more information, you can give us a call, 708-554-6730. If you're just like, yeah, no, this sounds great. I want to jump on board. I want to get a consultation. Great, come on board. Our consultation is 2 appointments, okay? These 2 appointments normally are $250. This month, we're offering 2 appointments for $149. Both appointments are 1 hour long. Okay, so that's 2 hours of professional time that you spend with me. And when I was working as a nurse practitioner at the urgent care, a physician's appointment to walk in an urgent care for cash was $100, and you're lucky you got 15 to 20 minutes with me, at an urgent care. And I can tell you that my boss was not very happy if I spent more than 15 or 20 minutes per patient. And in fact, if I could throw you out the door even quicker, that was even better in their eyes. So that was $100 just to spend 10, 15 minutes, maybe 20 if you were lucky. You got 2 hours of consultation time with me, guys. 2 hours for 149. So that's more than $100 off the original consultation price. And that's to help you get started on the right foot this new year. Okay. So now's never been a better time to get healthy and to take care of your underlying causes. So, and I can honestly say I can't guarantee anything, obviously, but on average, and that's a pretty good average, I've been doing this for 8 years. On average, we have anywhere from a 25 to 50% improvement in just 3 months. In just 3 months, guys, 25 to 50% improvement, okay, on average. And each person is a little bit different. But if you could take back your health, when was the last time you actually tried medication, and did you actually feel good? Maybe you guys have, but I hope you guys realize that your medication is just a Band-Aid. If I ripped off the Band-Aid, what would your symptoms be like? And if they come back with a vengeance or even worse, did that medication really heal you? Okay. That's the question that you guys have to ask yourself. So in 3 months, 25 to 50% improvement. How does that sound to you guys? We do accept HSA and FSA accounts, so that will pay for office visits, consultations, and supplements. All right. If you would like more information, give us a call, or if you'd like to schedule your consultation, 708-554-6730. Have a wonderful night, guys.